Can you spot symptoms of pustular psoriasis? Have you ever wondered how to recognize pustular psoriasis? This condition can be identified by several distinct symptoms that affect the skin and may even involve systemic signs. One of the most noticeable symptoms is the sudden appearance of red patches on the skin, which are covered with numerous small, white or yellowish pustules. These pustules are filled with pus but are sterile, meaning they are not caused by an infection. Rather, they result from inflammation. When looking for symptoms, pay attention to widespread red skin patches that may merge into larger areas. You might also notice scaling and dry skin accompanying the pustules. Affected areas can become swollen, red, and painful, and some individuals may experience itching or burning sensations. In cases of generalized pustular psoriasis, systemic symptoms such as fever, fatigue, headaches, and body aches can also occur. The pustules often appear quickly and can recur episodically. In milder forms, especially seen in children, you may observe ring-shaped lesions with pustules at the edges. Additional signs that can help in identifying pustular psoriasis include elevated white blood cell counts and markers of inflammation in blood tests during flare-ups. This reflects the systemic inflammation that can occur. It is also important to consider the involvement of nails and mucous membranes, which a dermatologist may check for other signs of psoriasis. A history of plaque psoriasis or triggers such as medication changes, infections, stress, or skin irritation can support the suspicion of pustular psoriasis. Diagnosis is primarily based on a clinical examination, focusing on the visual appearance of pustules on red skin along with associated symptoms. However, to confirm the diagnosis and rule out infections or other conditions with similar symptoms, doctors may perform a skin biopsy to examine tissue under a microscope or culture tests of the pustules to exclude bacterial or fungal infections. Blood tests may also be conducted to assess inflammation, organ function, and electrolyte levels. Recognizing these symptoms early is crucial, as pustular psoriasis can lead to serious complications like sepsis or organ dysfunction, especially in its generalized form. In summary, you can spot symptoms of pustular psoriasis by looking for rapidly appearing pustules on red, inflamed skin, often accompanied by scaling, pain, and sometimes systemic symptoms like fever. If you notice these signs, it is essential to consult a dermatologist for accurate diagnosis and management.